Hi, my name is San. I'm a level 1 student nurse. May I ask you questions?
Yes, you can.
Could you give me a spa report on the patient, please?
Okay, so our patient today is Jarvis Ronald. His doctor is Dr. Phillips. He's 67 years old, no known allergies. He is a full coat. His primary reason for being here is stage 2 diabetic ulcer on his right heel, which is 5.5 centimeters by 2.5 centimeters and 3 centimeters deep. It was noted 3 weeks ago before admission. The secondary diagnosis is diabetes mellitus type 1, which is usually regulated, but in the past 5 days it has been in the 300s. He came in with a pain of 6 out of 10 on his right foot with burning, and after administration of morphine at 16:10, his pain is now at 1 at 16:45. His last set of vitals was 128/70, 96/02, 76 heart rate. He does have an IV saline lock 20 gauge on his right medium vein. He is on a 1800 calorie diabetic diet with a 2 gram sodium restriction, and that's about it.
Why specifically is the client receiving this medication?
So his last AccuCheck was 242, and so obviously that is high, so we're going to be giving him insulin glargine and insulin regular today.
What action does the medication have on the body?
So it reduces the glucose levels by using glucose in the skeletal muscle and fat.
When should you question administering this medication?
So I would question it if his AccuCheck came back as 70. We don't want him to go and become hypoglycemic. So since it is 242, it is okay to give it to him right now.
Does this medication have a therapeutic serum level?
It does not.
Which vital signs must be monitored?
So we're going to monitor his BP, his heart rate, his temperature, and his O2 stats.
Which physiological parameters should be monitored when the medication is being administered?
Okay, so one of his insulin is long-acting, so it's going to have up to a 24-hour effect. So we are going to want to monitor his vital signs every 8 hours, make sure that there is no irritation in the injection sites, and that's about it.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
So we're going to want to check the dosage, the time, the route, the order, and make sure that it is the correct patient. We're going to want to rotate the sites too to prevent any irritation.
What interventions must be taught for taking the medication safely at home?
So we're going to want to teach the patient to make sure to rotate his sites, that he doesn't change out his insulin, that it is the current ones that we are giving him, and that he checks his AccuChecks before meals and before administering the medication, and to check the sliding scale for the regular insulin to make sure he needs it.
So what are the side effects and potential adverse reactions of the medication?
So this major side effect would be hypoglycemia, and adverse reaction would be anaphylaxis.
How will you know the medication is effective?
So his glucose levels will regulate, and they will be within normal range.
Thank you.
Okay, so we're going to go in here to 622 with Mr. Ronald. Hi, Mr. Ronald. My name is Jessica. I'm going to be your nurse, and this is San, the student nurse. I'm going to be giving your regular insulin and your Lantus insulin, the long-acting. Do you have any questions?
No, I don't think so.
Okay, so I just need to verify your name and your age.
My name is Ronald Jarvis, and I'm 67.
Do you have any allergies?
No, I do not.
Okay, good. So I've asked him about his allergies. I'm going to check to make sure that it's correct here in his charts. What do you know about this insulin that I'm about to give you?
I just know that it helps to lower my blood glucose.
That is true. So before you do take it, we are going to make sure that you're checking the glucose to make sure that you do need it, and that we're rotating the site so that we're not continuously giving it in the same place, or you might cause skin irritation or other effects there. Okay, so give me 1 second, Mr. Ronald. So we are giving the 2 insulins, which can't be mixed. Lances cannot be mixed with the regular. So I'm going to give the regular insulin first. And it is given 4 times a day. So I'm going to check to make sure that this is the correct patient. Here, the more. Okay, so I need to make sure that this is verified, so we need to make sure that the enter the screen before I give this. So we're starting off with the regular insulin. I need to make sure that it's the correct order against the mark. Make sure it's the right dosage. Check the expiration date. Make sure it's the right route for the right patient. And that he does need to be given it, and since his last AccuCheck was 242, today we're going to give 12 units of insulin. Since this is insulin, I need to have another nurse check this. So if Mr. Nurse can check that out for me, to make sure that's the right amount. And I have checked the medication here against the mark, and I have asked my patient his name, his birthday, his allergies. So, and I checked his wristbands to confirm all that. Where would you like this injection to be, Mr. Ronald?
I had my last one on my arm. Do you think we could do the abdomen?
Okay, so we are going to rotate it. So we'll do it in the abdomen, and we're going to do it on the left side and 2 inches away from the umbilicus here. It is a little cold. Okay, I'm going to pinch this up. This away. Okay, so that was the first injection of the regular insulin. do have another insulin to give, which is the Lances, which is the long acting. And it's going to be 18 units, and I have to check that, make sure that's correct. I have to scan the medication and make sure that it's green, it's verified. So to make sure that that is what I'm supposed to be given. I'm gonna wash my hands one more time here, and again, like I did with the regular insulin, I'm gonna check the name of the insulin, the dose, the route, the frequency, the time. Make sure this is the correct patient. Make sure it's the correct order. We are giving 18 units of this right now. Clean that off first. And since this is insulin, still I have to have a nurse double check it for me, so I'll have my student nurse make sure that's the correct dosage. Okay. So, Mr. Ronald, since we did give it on your left-hand side of your abdomen, where else would you like this injection?
Um,
Arm?
yeah, the arm would work, yeah.
And what was the arm that you picked last? So I don't give it in the same arm.
The last one was my left arm last
Okay,
time.
so we're going to give it in your right arm. Okay, so it's going to be a little cold. Let me pinch this up. Okay, Mr. Ronald, do you have any questions?
No.
Okay, so we're just have to remember that we're going to be rotating the sites. Make sure you double check your AccuChecks before giving these. You are on an 1800 restricted sodium diet, so we're going to keep on top of that. That way we can regulate your glucose, and I will bring some pamphlets in so you can look over that. Okay?
Thank you.
So I'm gonna lower the bag, give him the call light, and
Yeah, I have a few more questions.
yes.
Were there any patient piece of information you reviewed before administering the client the medication?
I reviewed the AccuCheck, which was at 242, so I did give him his insulin because if it was below 70, I would not have given it to him.
Did this information affect your decision to administer medication?
It did because we did give it to him. Had it been lower, I wouldn't have. I did ask him about where his last injection was, so we could rotate that side as well.
Did this information affect how you administered the medication?
No, we gave it to him because it was 242. His glucose level.
Thank you very much.
You're welcome.